Hello everyone, myself Joswita Monteiro, Assistant Professor, Medical Imaging Technology. Today we will be talking about hysterosalpingography. It's a radiological procedure. So at the end of this session, the students will be able to define HSG and its importance, explain about its indications and contraindications, describe equipments and technique used for HSG, prepare patients and filming done for the HSG procedure. Before going for the HSG procedure, let's have a brief introduction about female reproductive system. So female genital organs are classified into two, that is internal and external genital organs. So internal genital organs consist of namely a pair of ovaries, uterine tube, uterus, vagina, and external genital organs consist namely mons pubis, labia majora, labia minora, clitoris and vestibule. Coming to the ovary, it consists of pair of ovaries. So it's a female gonads which produce ova. So ovary is situated in the ovarian fossa on lateral pelvic wall, and it's a almond in shape which is 3 cm long, 1.5 cm wide and 1 cm thick. Uterine tube, which is also known as fallopian tube, which are the tortuous ducts which conveys the ova which is produced from the ovary to the uterus. So this uterine tube will be about 10 cm in length, and also it has mainly 4 parts. They are infundibulum, which is 1 cm, ampulla, which is 5 cm, isthmus, which is 3 cm, uterine or intramural part, which is 1 cm. At the end of this infundibulum, it consists of finger-like structures known as fimbriae, which helps in collecting the ova which is produced from the ovary, and it sends to the fallopian tube. Uterus, which is also known as womb, it's an organ which protects and provides nutrition to a fertilized ovum. So it is situated in the lesser pelvic between urinary bladder and rectum. And coming to its measurements, it's about 7.5 cm in length, 5 cm in breadth, 2.5 cm in thickness, and it weighs around 30 to 40 grams. Vagina, which is situated behind the bladder and urethra, in front of rectum and anal canal. So the diameter of the vagina will gradually increase from below towards upwards, and vagina is also known as birth canal. So this is the image of female reproductive system, which consists of pair of ovaries, fallopian tube, uterus, cervix and vagina. So coming to the main topic, that is hysterosalpingography. So it is also known as HSG. So HSG is a radiological procedure to study the uterine cavity and fallopian tubes by injecting the contrast media into the uterus. So coming to the indications, so in which all conditions we can go for this procedure. So if the patient is having a history of infertility, recurrent abortions following tubal surgery like tubectomy, migrated IUCD. IUCD is nothing but intrauterine contraceptive devices, like for example copper T. So to check the situation whether it's present in the actual position. Then uterine and tubal lesions like tuberculosis, submucous fibroids and polyps. So coming to the contraindications, so in which all conditions we cannot go for this HSG procedures. Conditions like pregnancy, sensitive to contrast media, that is if the patient is having any allergy to the contrast media, suspected pelvic inflammatory diseases, it can be either inflammation of the uterus, inflammation of the ovary, inflammation of the fallopian tubes, purulent vaginal discharge, which is also known as cervicitis, if the patient is having excess secretion from the vagina, severe renal or cardiac disease. So these are the conditions in which we cannot go for the HSG procedures. So coming to the equipments and specialized instruments which are necessary during the HSG procedure. First one is SIM speculum. So this is the device which is used to open the vagina. Tenaculum, which is used to hold the anterior clip of the cervix, and also it helps in giving the traction. Fluoroscopic unit with spot film devices, which is used for guiding and taking the images. Vaginal speculum, which is used to expand the cervix. Valsalum forceps, which is used to hold the catheter. Uterine sound and dilator, which is used to dilate the cervix, and also it helps in the measurement in the depth of the uterus. Catheter, cannula like Leach Wilkinson's, Jarko types, Pacman. These are the types of cannulas which can be used. 20 cc, 5 cc, 2 cc syringes, and local anesthesia. Coming to the contrast media. So these following are the 4 contrast media which can be used for the HSG procedures, like urographin 60%, Condray 280, Trivideo 280, and angiographin. So the volume of the contrast media which can be used is around 10 to 20 ml. So in nulliparous women, so these are the females who did not give any childbirth. In that condition we can go for around 3 to 4 ml of contrast. And in the case of hydrosalpinx, hydrosalpinx is the condition which is inflammation of the fallopian tubes. So in that cases more than 10 ml of contrast media is necessary. So coming to the patient preparation for the HSG procedures. So the appointment for the HSG should be given between the 8th and 10th day of the menstrual cycle. So this time is the ideal period because there will be less chances of pregnancy, and apprehensive patients may need pre-medications, like some patients will have anxiety issues. So in such patients we will give pre-medications. Then before starting the procedure, inform the patient to empty their bladder, because this full bladder will elevate the fallopian tube and can cause apparent tubal blockage. Then abstain from intercourse and explain the procedure, change the patient to hospital gown, and consent from the patient should be taken before the procedure. Coming to the pre-medication, so if the patient is having any anxiety issues, then diazepam 5 to 10 mg, which is given intravenously 30 minutes before the procedure, and atropine, which is 0.6 mg intravenously, which is given 15 minutes before the procedures. So coming to the techniques. So basically there are 2 techniques in the HSG procedure, that is by using a cannula and by using a Foley's catheter. So first let's see the cannula technique. So here the patient will be in the lithotomy position at the edge of the X-ray table. Then the radiologist will clean the vagina with antiseptic solution or betadine, and this procedure is done under sterile condition. And then speculum is introduced into the vagina, and the anterior lip of the cervix is held with tenaculum and gentle traction is applied. Then cannula is inserted into the cervical canal under direct vision. Speculum is then removed and patient is carefully moved up the X-ray table in supine position. So under fluoroscopic control, 2 ml of contrast media is injected to outline the uterine cavity. So to prevent the leak of the contrast media from the cervix, gentle traction should be kept by the tenaculum. So injection is then continued slowly, governed by patient's tolerance, until the oviducts, that is fallopian tube, have been outlined and free intraperitoneal spill of dye is visualized. So coming to the filming, basically in HSG 2 films are taken, that is as the tube begins to fill and when the peritoneal spill occurs on both the sides. So coming to the second technique, that is Foley's catheter technique. So here we are using Foley's catheter. Foley's catheter is nothing but it is the catheter which is made up of rubber material. On one side it is having two ports, that is, one is for inflating the balloon and one is for injecting the contrast media, and on the other side of the balloon catheter it consists of a balloon so that it can be inflated. So coming to the procedure, here the patient will be in the lithotomy position at the edge of the X-ray table. Then the radiologist will clean the vagina with antiseptic solution, and this procedure is done under sterile condition. Then vaginal speculum are swabbed with antiseptic solution and the vaginal speculum is introduced to the vagina. Then the Foley's catheter is inserted through the cervix into the uterus. Once the Foley's catheter reaches the uterus, then gently inflate the balloon of the catheter with 2 ml of distilled water. So after inflating the balloon, slowly we have to pull downwards the Foley's catheter against the internal OS. Internal OS is between the opening between the uterus and the cervix. So after pulling down the Foley's catheter, speculum is withdrawn from the vagina and the catheter, that is Foley's catheter, is attached to the syringe which is filled with a contrast media, and slowly tell the patient to move on the table in a relaxed supine position. Then under fluoroscopy guidance, contrast media is injected and filmings are taken. So coming to the filming, as the tube begins to fill and when the peritoneal spill has been taking place. Then coming to the advantages and disadvantages of the Foley's catheter technique. So advantages of Foley's catheter technique is that it can be controlled by single operator and avoids uterine perforation and no metal artifact is in the images can be seen. Then coming to the disadvantages, tip of the catheter sometimes blocks the tube. Part of the uterus adjacent to the bulb cannot be studied. So coming to the aftercare, ensure the patient is comfortable without no significant discomfort before she leaves the X-ray room, and patient should be informed that there will be mild bleeding for 1 to 2 days, and if the patient is having any severe pain, then painkiller can be given. Coming to the complications of this HSG procedure, so during the insertion of cannula, the patient might feel a severe pain and can also cause trauma to the uterus and peritoneal irritation due to the injection of contrast media and exacerbation of the pelvic infection. So this is the image which one shows, first image shows the HSG with normal fallopian tubes, and the second image shows the HSG with a blocked tube, that is in the one side, left side, the fallopian tube has been blocked, so the contrast does not flow. So this is the image which shows the conditions hydrosalpinx on both the side of the fallopian tube. Submucosal leiomyoma, it is the condition, that is the fibroids which can be seen in the uterus. Bicornuate uterus, it is the malformation in the uterus. So this is a small video which shows the HSG procedure with cannula technique. So female reproductive system consists of uterus, vagina, cervix, fallopian tubes and a pair of ovaries. So patient will be in the lithotomy position at the edge of the table, and the procedure is done in a sterile condition and speculum is introduced to the vagina, and by the direct vision the cannula is inserted through the cervix, and once the cannula reaches the uterus, under fluoroscopic guidance we will inject the contrast media and check the flow of the contrast. If there is spill from both the side of the fallopian tube, then the HSG will be normal, and if there is any blockage on either side of the fallopian tube, then it indicates there is abnormalities in the patient. So to summarize the thing, like HSG, that is hysterosalpingography, is a radiological procedure which is used to study the uterine cavity and fallopian tubes by injecting contrast media into the uterus. So X-ray images, that is films, are taken during the procedure to visualize the shape and structure of the uterus and fallopian tubes. So this HSG procedure helps to identify any blockages or abnormalities in the fallopian tubes that may be causing infertility or other reproductive issues. These are my references. Thank you.